how are you doing today? I'm Nurse Molly. I'm just going to have you verify your name and date of birth for me.
Okay.
Alright, thank you. Do you have any allergies? Alright, today we're going to be inserting an NG tube. I'm going to insert it through your nares. Have you ever had one before? You have. Okay, so you're familiar. I'm going to be inserting a 12-inch Cilium tube because this patient has obstructed bowel, and I'm going to double check my orders with my MAR. 14-inch tube for obstructed bowel, type is sump. It's a dual lumen and it's a systemic tube. I'm going to head and perform my hand hygiene. And I'm also going to verify the integrity of my bag for my tubing and make sure it's not expired. And I'm going to measure the length of the tube into the patient. Starting at the tip of the nose, to the tip of the ear, to the xiphoid process. I'm then going to mark it with my pen, and then afterwards I'll put a tape just in case my marking disappears. But I have my tube length ready. I'm going to check the patient's hands. You could just occlude one there and breathe in, breathe out, and the other one. I'm also going to check the patient's oral cavity. I'm going to place the tube, which I found was most patent, is the right nostril. Right. I'm going to perform hand hygiene once again, and then apply my gloves.
Alright, so I've already prepared my tape for the.
Do you need to go to the bathroom before you begin the procedure? No? Alright.
I've already done my hand hygiene.
I'm going to place a towel here. I have my basin ready. I have water in my cup.
Same thing.
I'm going to lubricate the 4 inches at the beginning of the tube. Alright. I'm going to begin inserting. So Mr. Jackson, I'm going to have you tilt your head back, and I'm going to slowly begin inserting the tube by twisting.
I keep looking at it like I want to, and then I'm like, shoot, I don't need it.
As the patient begins to sign of struggling, I'm going to place his head forward and give you a sip of water. If that didn't work, I'd give you some ice cubes to chew on. And as I begin to insert more, I keep inserting until I reach my mark.
I'm going to walk into the patient's room.
At this time, I'm then going to temporary tape my tubing so I can verify my placement and check my gastric contents. There's no coiling in the oral cavity. If you could just speak for me, Mr. Jackson. Alright, patient has clear speech. I'm going to have my stethoscope in now as I check my gastric contents.
This is longer. Okay. This is longer. This is longer. I found it.
I'm going to pull back the gastric contents to 30 mLs.
Dispose of my needle.
I see green and yellow, which is what I would like to see. Before I insert, I'm going to place my stethoscope on the xiphoid process so I can note sounds of gurgling as I inject the contents I pulled out.
I'm going to start off by verifying my doctor's orders some more. I'm also going to verify the type of
Gurgling sounds were heard.
I've already prepared my tape.
I'm going to attach the tube to the low intermittent suctioning. I'm then going to take this to a comfortable position on the bridge of the nose. Alright, and add another tape.
Nasal surgery or any bleeding or any problems?
I would have the patient turn their head so I make sure I have the right amount of slack, and then would attach a paper clip and tie an elastic band, attach the gown
So now I'm going to
for comfortable placement. And then it would go ahead and document color, consistency, odor, the length of the tube, which narrow I chose, and I would also note the low intermittent suction. I now am going to come back every 2 hours to verify the placement, and every 4 hours I'm going to irrigate and flush. Every 2 or 3 hours I would also visit the patient to perform oral hygiene. So now that I am back to irrigate, I would attach the suctioning tube.
So I got my loop. I'm going to move the tip of my tubing 4 inches.
I am going
I'm going to have the patient put their head back against the pillow.
to pull back 30 cc's. Make sure the color consistency is still the same, which it is, before I reinsert the pullback contents. I'm going to go ahead and listen to the xiphoid process.
I have the patient put his chin to the chest while he was swallowing or with water. I'm going to advance the tubing.
Alright, gurgling sounds were noted, so the placement is good. I'm then going to flush with normal saline. I'm going to flush with 30 mLs.
And now I'm going to go ahead and check out this one.
Well, you also forgot to say, you only said 2 of the instead like 2.
I'm going to ask the patient to say for me. Can you state your name?
So you said the bouncer?
Alright, after flushing the 30 mLs, I'm going to go ahead and start pulling out the gastric contents until I no longer feel resistance. I started with 60 and I'm going to dispose until I reach my resistance, and I'm also going to document input and output. And I'm going to continue to do this until I reach what I had started with, the original 30 mLs. After that, I'm going to reattach the suctioning, and I'm going to go ahead again and document color, consistency, odor, length, which I chose, my date, initials, time, and the procedure which was done. And after each time with the procedures, I would do the 4 Ps, which is position, make sure the patient's belongings were set, and if the patient has to go to the bathroom, if the patient's in any pain. Just want to know at the beginning of the procedure, the patient will be placed in a high Bowler's position, which at the beginning of the procedure, I already had them placed.